Thank you everyone for joining us today. My name is Mike Cantone. I'm the political director for Organize Now. We're joined with our partners here representing AFSCME, retirees, children, and concerned seniors from the Orlando area. And we are here to thank Senator Nelson for his previous leadership on healthcare reform and specifically for standing up for Florida seniors time and time again. Today we remind our elected officials of the Floridians at risk of losing benefits and their health care because of the Republican budget proposal, or known as the Ryan budget, which was passed in the U.S. House last week. We once again call on Senator Nelson to stand up against these attacks from the Republican Party and to stop these dangerous policies in the U.S. Senate. We will now hear from Floridians who will be directly impacted by these policies, and I'd like to start by introducing Dolores today, who is an active retiree.
Hi there. I'm reviewing new statistics on the Social Security work for Florida Recreational Security. Total annual benefits is $1,526,000. The number of residents receiving Social Security benefits is 121,218. Retired workers beneficiaries are 79,542 who are on Medicare, and disabled worker benefits is 16,986 who are Medicaid. That shows you how much people who are on Social Security need your help. So let's have Senator Nelson make sure he sticks with us and gives us the best thing that he possibly can. A nice vote.
Thank you, Dolores. Now I'd like to introduce Joe Boyer, also an AFSCME retiree.
Yeah, welcome. The AFSCME retirees got a few things to say. Some congressional leaders are proposing to destroy Medicare and Medicaid and even threaten Social Security. And they are planning to do this while at the same time preserving subsidies for big oil companies and cutting taxes on corporations and millionaires. These proposals and others that would cut the lifeline for seniors and the disabled must be stopped. In the past, we've relied on Senator Nelson to look out for the interests of the middle class. Now we call on him to do this again by protecting Medicare, Medicaid, and Social Security from those who would pull the plug. Extremist politicians in Washington have their priorities upside down. Their plan ends the guaranteed coverage of Medicare that every worker is paid for. It replaces Medicare with limited benefits from a private insurance company. Their plan would increase premiums and out-of-pocket costs substantially for seniors and the disabled. It would put us at the mercy of the insurance company. The cuts to Medicare or Medicaid are so severe that it would dramatically raise the cost of nursing home care, making it unaffordable for millions of families seeking care for the most frail. And while their plan does not include detailed cuts, it lays out a process for cutting Social Security. This vision of deficit reduction is to shift the entire burdens onto seniors, the disabled and working families. Rather than shifting the burden on those least able to pay, they should stand up to the special interests and demand that they share the load. I know we have a deficit, and that means making tough decisions about the federal budget. But there is a right way and a wrong way to do it. I pay my share in taxes. Millionaires and corporations should do the same. I can't figure out why anyone would want to cut our lifeline in order to preserve tax breaks for corporations and the wealthy. I can't figure out why they demand that we sacrifice more to continue their tax breaks. I want my children and grandchildren to retire securely, like I did. And we're counting on Senator Nelson to make sure they can. Thank you very much.
Thanks, Joe. And now I would like to introduce Doug Head, who is a very active Orlando resident and concerned citizen.
Hi folks, I'm happy to be here today because I want to talk about the illogic of this proposal that emerged from the Republican House. And certainly I am confident that Senator Nelson will stand with Floridians, senior citizens, children, and the disabled in defending Medicaid benefits and defending the current Medicaid system. Under the Republican proposal, the shift of costs would be almost entirely to the state taxpayer from the same person as a federal taxpayer. And the name of rationalizing the budget and reducing expenses, the government should be looking at logical and appropriate reductions of expenses. There are a lot of places to find them. Among them are the Defense Department. Amongst them are tax expenditures, where taxes are given back to the wealthy in this country rather than to support those who are in greater need. It's my view that shifting the taxes and the costs of Medicare to the state level with the block grant program does nothing but ensure that Floridians will face a crisis in the future, a greater crisis than in most other states, because in Florida, where we have so many seniors and the potential for so many future retirees and such a low cost for health care, we'll get less money than many other states. It's an illogical shift. It does nothing but move the bill from one of our pockets to the other of our pockets, and it makes no sense. I urge everyone to think specifically about the plight of our Medicaid recipients who are disabled. This can happen to any one of us in the workforce. I have a good friend who is in a nursing home in Ocoee and is basically bankrupt today from medical bills, which she did not anticipate because she has bad genes in her family. Now, it is irrational to think that that woman would be put on the street or allowed to die rather than benefit from a Medicaid system that currently works and pays her bills. Capping the benefits and taking the money in a block grant sum for Florida would only serve to compel the legislators of Florida and the governor of Florida to take away her benefit because they couldn't afford it. It makes no sense. Let's not do it. I'm confident that Senator Nelson understands the issue, and I'm looking forward to his standing strongly against this proposal as it emerged from the House. Thanks.
And also, real quickly, I'd like to introduce Tim Murray, who is a member of Organize Now, and also concerned about this.
Hi, how are you doing? Hi, Jess. I'm Timothy Murray. I'm a member of Organize Now. I just really want to follow up basically what Doug's saying. Our hope is all focused on Senator Nelson now. He needs to stop these Republicans who are sacrificing the programs that are important for seniors, people with disabilities, children, and the middle class in order to give their corporate cronies and the richest Americans yet another tax break. For corporations and the wealthy, this budget is a path to prosperity, but for the rest of us, this path leads only to poverty for families and communities. We're just basically calling on Senator Nelson to stand on the side of his constituents and oppose these and all the proposals that cap spending by putting more burden on the seniors and the middle class. Senator Nelson should be on our side, not on the side of wealthy special interests who avoid paying their fair share for long enough. It's time for them to right, Jackson.
Thank you, Tim. So as you can see here, it is clear we are here to thank Senator Nelson and to urge him to stay strong, specifically around the spending caps on Medicaid and Medicare services, but also in standing firm with the seniors and people of Florida against the special interests and Republican budget policies. Thank you.